welcome everybody. Impressive building, right? This is the second time I'm in this building. It really impresses. But I'm really missing the old E-building, weighted with history, negotiations, big discussions, shaping NCD and mental health agendas and many more. So many years. I'm missing the tone. As soon as you go into that E-building, it's a very nice tone, negotiation and consensus building. But we'll do the same. We'll do much more in this new building. It's a great environment. And welcoming you to the 10th annual meeting with the Friends of the Task Force. We'll get to some details, but a milestone because we're hosting it in the sidelines of the World Health Assembly this time. My name is Guy Phones. I'm heading the cross-cutting and integration unit in the Department on NCDs and mental health. We are really pleased in that unit to host the Secretariat of the Task Force. And I was also saying in previous years, the meeting of the Friends of the Task Force was rightly hosted in the margins of the UN General Assembly. Much of the discussions around the priority setting with members of the task force and then delivery of the task force mandate was reported and commented on in the margins of the General Assembly. This year is the first time that the Friends of the Task Force are convening in the sidelines of the World Health Assembly, and it is actually a pretty fitting moment. It makes so much sense. When the call for this meeting, and so many calls we've been hearing already in the 2-3 days of the Assembly, is to move from global commitments toward contextual country-level implementation of that milestone political declaration. I'm going to quote a message from the RD Afro, which I think we heard earlier, which is so important for our discussion today. Political declarations don't save lives. It's how these are effectively implemented that will. I think that's been the tone of our discussions in so many meetings with partners, member states, constituency networks, alliances, where we come together and understand how we could actually deliver on those commitments. And I would add also how we could hold ourselves accountable to those commitments with strong formal accountability and monitoring frameworks. But we'll probably get to that in the discussions. And as I said, a few housekeeping remarks. This is, as you can tell, is a spanking new room. And one of the innovations is that it does not have microphones. We hope that someone is listening and we can get some mics hidden in the room or somewhere, but I think we can hear ourselves well. And I hope those online can also hear as well. I think that is the innovation in the room, that it does allow for online audio to work very well. But anyway, let's keep the speakers clear, strong voices. And we hope that those in the room can maintain an environment that also allows for that discussion to happen. All right. We are really delighted to recognize that the event is hosted by the governments of the Russian Federation and of South Africa, with the support of the Secretariat of the UN Interagency Task Force on NCDs and UNDP. And this is our first meeting since the adoption of the 2025 political declaration. And as we were saying, we aim to explore how we can collectively shift the center of gravity towards country-level implementation of those commitments in mental health and deliver on those commitments through accountability frameworks. The second of the 3 DG-hosted strategic roundtables happening this week, which is very important. Only 3 will be hosted by our Director General. The second one happening tomorrow is also rightly entitled, It Takes a Village. This is the village. This is part of the village that it takes to implement integrated and intersectoral responses for NCD and mental health. So let's see what the village has to provide support on. We will be beginning our remarks by the 2 co-hosts, which will join us a little while. It's slightly delayed. We look forward to just welcoming our co-host, fellow Glenda Shirley.
Yes.
Charles Affair, Permanent Mission Engineer for South Africa. And South Africa, I'm delighted that is one of the hosting member states. Welcome. We'll give you some time to settle in. We'll come back to you. you some time. Deputy Minister of Health from Russian Federation will join us shortly also. So maybe we'll come back to those opening remarks. You can find your way into your documents. So we'll go to the next agenda item, which is an important one here, which is the update on the achievements of the task force over the last year. And Alexei, over to you.
Thank you, Guy, and good afternoon, colleagues and friends. I want to give you a short update on the task force, why this agenda still matters, what changed after the 2025 political declaration, and how task force is supporting the implementation through the partnerships, through the catalytic financing, through support of the UN country teams, and work on its own future directions, especially in the context of the UN80 reform. NCDs and mental health continue to place a major burden on countries and communities, and they are not just health issues. They affect development, equity, economic performance, and social well-being. There has been progress in some areas, but overall it is still uneven and too slow. Most countries are not on track to meet SDG target 3.4, so the need for stronger implementation and sustained political attention remains clear. The 2025 political declaration matters because it sharpened the focus on implementation. It made clear that commitments at global level now need to lead to practical results at the country level. It also reinforced the need for coordinated support across UN system. For the task force, that means a stronger platform and a clear expectation to help countries move from commitment to action over the next 5 years. The task force exists to support member states through a more coherent UN response. Its role is not to duplicate what individual agencies are doing, but to bring that work together in a more strategic and practical way. That includes technical assistance, policy support, partnership building, and catalytic development assistance. Its value is in helping the UN system respond more effectively to country priorities. What is helpful now is that the results agenda is clear. Member states agreed 3 measurable global outcome targets for 2030 and identified 5 system priorities that are critical for delivery. That gives more practical framework for action. The political declaration also sent a clear message that WHO, the wider UN system, the task force, and the Health for Life Fund all have an important role in supporting implementation at scale. One of the clearest examples of practical support from the task force is the investment case work. Over the past year only, several countries published their NCD, mental health, digital health, nutrition, assistive technologies, air pollution investment cases. These help governments make both the economic and policy key for action, and they support dialogue across sectors. Malawi also endorsed the investment case on NCD treatment. Overall, the task force has supported over 70 countries in the last 10 years. Partnerships are also helpful to turn strategy into implementation. Through the WHO-led SAFER initiative, the task force secretariat and members are supporting policy dialogue, inter-country learning, and evidence-based action on alcohol. On cervical cancer, the Joint Action Group has continued to support countries on policy, vaccination, screening, and treatment. On digital health, WHO, ITU, and partners are promoting digital public infrastructure for health, and the first national digital health investment case and AI chatbot for NCDs were kind of promoted in Gambia. That shows how digital tools can strengthen NCD action. In 2025, G20 and G7 Health and Development Partnership, the Task Force Secretariat and UNDP launched a new legislators initiative to strengthen action on NCDs and mental health. It brought together a small group of prominent legislators from different parts of the world, along with UN partners, some experts from member states. The Global Legislators Report and Model Resolution were launched in Geneva in June and later during the 80th session of the UN General Assembly in September. This work highlights the important role legislators can play in driving stronger action. Follow-up program of action is now being started. The Health for Life Fund remains an important source of catalytic support. In 2025, it launched a new round of multi-year grants with a new support in Lao PDR, Papua New Guinea, and Sierra Leone, with Rwanda and Zambia continued early implementation. The fund has also expanded its learning role through the South-South and Triangle Cooperation Learning Laboratory. In its first year, that included dialogue on scaling up investment, cross-regional exchange, and shared recommendations to support implementation. To date, the fund have received $8 million in pledges, 4.5 million for disbursement. A review of 114 cooperation frameworks published in January this year showed that NCDs and mental health are becoming more visible in UN country planning, and that is encouraging. But it also showed that there are clear weaknesses. In many cases, integration is still general, with limited specificity, weak indicators, and insufficient accountability. Since these frameworks shape UN support at country level, this matters. And the task force will therefore continue working with UN country teams to improve the quality and coherence country level action. The awards are one way of recognizing practical innovation and keeping momentum behind implementation. Last year, awards were focused on obesity prevention and control, and 19 winners were celebrated during the UN General Assembly High-Level Week. Today, we are pleased to launch the 2036-27 call, which will focus on chronic respiratory diseases and hypertension. Beyond recognition, the awards are also helping build network for peer learning and exchange with countries and partners. Alongside implementation, there is also important discussion about future direction of the task force. The independent evaluation published in January this year was strongly positive and described the task force as an example of UN working as one. At the same time, the wider UN and global health context is changing quickly, with pressure for sharper focus, clearer value added, and greater sustainability. WHO's management response therefore launched a structured process to consider the task force's future direction, and members are now providing feedback on the options. The overall message is simple. The political mandate is stronger, and there are clear examples of progress through partnerships, investment cases, catalytic financing, and support to countries. But the implementation gap remains real, especially at the country level. The priorities now is to sustain and indeed enhance a focused, coordinated, and practical response that helps countries move faster and further on NCDs and mental health. The question is not whether coordinated UN support needed, but how to shape the most relevant and sustainable model for the future. UN80 initiative provides an important opportunity to build what works, focus where the task force adds most value, and ensure that support to countries and UN country teams remain practical, coordinated, and fit for purpose. We look forward to continuing that work together with you. Thank you for your attention, and right back to you.
We will now move into an interactive panel discussion, but first, let's come back to our esteemed co-chairs, and it's a pleasure to give the floor to Mrs. Sholofela Glenda Shiole for her opening remarks on behalf of South Africa.
Thank you very much, Guy, and let me start off by apologizing for my attendance this afternoon. and for being extremely late. There's really no excuse. So I'm completely sorry. But maybe also address my pet peeve that has nothing to do with everyone in the room. I usually don't use my middle name, so I'll appreciate.
We don't.
Yes, it's limited to my passport, honor of my father, but that's where it ends. So I call myself Solofelo, and most people call me Solo. Excellencies, distinguished colleagues, ladies and gentlemen, it is a profound honor to welcome you all today on behalf of the government of the Republic of South Africa and alongside our fellow organizers in the Gambia. We gather here on the margins of the 79th session of the World Health Assembly at a critical juncture for global health. Last year, the UN high-level meeting adopted a political declaration on non-communicable disease, mental health, and well-being, which for us was quite historic. For the first time, our global community committed to concrete, measurable targets spanning NCD financing, mental health, integration, and environmental determinants like air pollution. But as we sit here today in Geneva, we must confront a sobering reality that the gap between political declarations signed in New York and actual national implementation remains wide. For too many countries, particularly across the global south, the bold commitments we make on paper are hindered by a lack of fiscal space, limited regulatory authority, and fragmented cross-sectoral coordination. Sustainable financing remains a binding constraint. We have mountains of evidence proving that NCD interventions are exceptionally cost-effective. Yet, domestic health financing stagnates and external development assistance for NCDs remains stuck at a dismal less than 2% of global health aid. We cannot achieve universal health coverage or fulfill the promise of the 2025 declaration through fragmented, disease-siloed approaches. We must elevate country-level models and build robust domestic budgeting integrated into medium-term expenditure frameworks. South Africa's strategic response to this challenge is clear. We cannot achieve universal health coverage or fulfill the promise of the 2025 declaration through fragmented disease siloed approaches. Our national trajectory is unyielding in its commitment to build a unified national health system through the operationalization of our national health insurance framework, as we call it, the NHI. The NHI is rooted in the principles of social solidarity. It seeks to pool the resources equitably to ensure that every citizen has access to comprehensive care, including NCD prevention, mental health services, and long-term care, without facing catastrophic health expenditure. We must elevate country-led models that build robust domestic budgeting integrated into medium-term expenditure. Catalytic and innovative financing mechanisms such as Health for Life Fund must align with and reinforce these national universal coverage frameworks rather than bypass. We must leverage innovative catalytic financing mechanisms to bridge these resource gaps and build resilient unified health systems capable of tackling the shifting burden of disease. South Africa firmly believes that multi-sectoral social solidarity is key. South Africa views the fight against NCDs through the lens of health sovereignty. We must break down structural silos between health, industrial policy, and environmental planning. Air pollution is the single largest environmental risk factor for NCD, claiming over 7 million lives annually. Chronic respiratory disease bear the heaviest brunt of this crisis. It is time to structurally integrate air quality into our national NCD planning and health sovereignty strategy. To that end, South Africa is highly encouraged by the focus on the 2026 2027 UN Task Force Awards launched today, which rightly recognizes outstanding multi-sectoral action on air pollution and chronic respiratory disease prevention. Finally, this event offers a timely platform to look inward. As we navigate the UN 80 modernization reform and review the recent independent evaluation of the interagency task force, we have an opportunity to sharpen our primary mechanisms for whole of UN action. The task force is not a talking shop. It delivers high quality, practical technical support where it matters most. That is on the ground and in our countries. Our objective today is simple. We have to move from declaration to delivery. Let us use this session to share practical, reproducible country experiences, align our external partnerships, and mobilize the political and financial capital necessary to save lives. Thank you, and I look forward to an impactful discussion.
Excellent. Thank you so much, Olafilo. Not only a very clear call to action from a country from the ground up, but you've just provided us with a clear roadmap of action. Excellent roadmap of how to implement that politicization commitment. But the important is that it's based on social solidarity. Anchored on social solidarity. This, we are still waiting for the co-chair to be available. So we will move into the very interesting interactive panel discussion led by the champion of the Secretariat, Nick Panadvala.
Well, that's interesting
Because you want me to introduce the panel?
I'm delighted to introduce the panel, but I thought that Guy, you introduced the panel, but I'm delighted to introduce our distinguished panel, and I will be guiding you. And just as well, there wasn't a microphone, isn't there? So May, Guy was explaining that one of the great things about this room is that you have to speak loudly because with new technologies, microphones are not part of it. So there you go. So we've got a very distinguished panel in front of us. And I think what I will do is, well, let me just introduce all of them. We've got Jose Luis Castro. Jose, welcome to the panel, and thank you for putting up your hand. He's the Director General Special Envoy for Chronic Respiratory Disease here at WHO. And then we've got Jacqueline Alvarez, who's the Chief of the Chemicals and Health Branch at UNEP. Thank you so much. Then we've got my dear friend here, May Abdul Wahib, who's the Director of Division of Human Health at IEA, all the way from Vienna. And then we've got our UN resident coordinator from Thailand, Michaela Friedberg-Story.
By video, yes.
By video.
By video. By video. This microphone business is a challenge. It really is. Well, the ears are a challenge. And then, all the way from New York, we've got Natalia. There we are, waving hands. And then we've got Alison Cox from the NCD Alliance, who's the Director for Policy and Advocacy. And then we've got Lamia Mahmood. Welcome, Lamia, who is the Regional Advisor on Non-Communicable Disease Prevention and Healthcare, WHO EMRO.
All the way from Cairo.
All the way from Cairo. So just remind me where you've come from.
I'm based in Geneva.
You are, exactly. All the way from Geneva. So let's start. And I'm going to ask my colleague Alexei just to remind me of the rules. How long does each person have to speak?
Yes, so it's 4 minutes per speaker, and we would ask you to speak a bit louder, taking all this microphone business.
Okay, so given all this microphone business, or lack of microphone business, you're asked to speak loudly. So, Jose, floor is yours.
But thank you very much. Is that loud enough for everyone?
Perfect.
Thank you. Excellencies, distinguished colleagues, ladies and gentlemen, It is a great pleasure to join you today at the annual meeting of the Friends of the Task Force and to have the opportunity to speak about chronic respiratory diseases and air pollution, two deeply interconnected challenges that continue to affect millions of people worldwide and disproportionately impact the most vulnerable populations. The adoption of the 2025 Political Declaration on Non-Communicable Diseases and Mental Health marked an important milestone for the global health community. Importantly, it affirmed the urgent need to strengthen action on chronic respiratory diseases, particularly asthma and chronic obstructive pulmonary disease, which continue to represent the largest respiratory disease burden globally. The political declaration sends a clear message. We can no longer afford fragmented and delayed action. The evidence is clear. Air pollution remains one of the leading preventable risk factors for chronic respiratory diseases and premature mortality globally. And at the same time, millions of people continue to face barriers to prevention, early diagnosis, treatment, and long-term management of COPD and respiratory conditions. Today, our collective responsibility is therefore not only to acknowledge these commitments, but to operationalize them, translating political momentum into concrete action, multi-sectoral collaboration, and measurable impact at the country level. In this context, I'm pleased to share that the Task Force Awards Scheme 2026-27 will be dedicated solely to recognizing excellence, innovation, leadership in tackling air pollution and the prevention and management of chronic respiratory diseases. The initiative seeks to celebrate and elevate outstanding efforts undertaken by governments, civil society organizations, academic institutions, and other relevant stakeholders who are contributing to healthier environments and stronger respiratory health outcomes. Importantly, the awards are not only intended to recognize achievements, but also to foster knowledge sharing, inspire replication of best practices, and strengthen the global momentum for implementation of the commitments contained in the political declaration. So allow me, therefore, to warmly encourage all of the participants here today to actively engage with this initiative and to submit and or invite nominations once the call is launched. We strongly encourage nominations from that showcase impactful, scalable, and equitable approaches, particularly those demonstrating multi-sectoral collaboration, innovation, community engagement, and a strong focus on vulnerable populations. The official call for nominations is expected to be published early in June through the channels of the task force and partner organizations. Detailed information will be made available regarding eligibility criteria and nomination procedures. Evaluation processes, timelines, and thematic categories. We anticipate that eligible candidates will include institutions and initiatives from a broad range of sectors and regions, reflecting the understanding that addressing air pollution and chronic respiratory diseases requires the whole of government and the whole of society approaches. We hope that this initiative will serve not only as a recognition platform, but also as a catalyst for stronger partnerships and accelerating action. The commitments have been made, the evidence is clear, the tools and the knowledge already exist. What is now needed is to sustain implementation, investment, accountability, and stronger collaboration across sectors and stakeholders. So let us continue working together to ensure that cleaner air, healthier environments, and better respiratory health become a reality for all. Thank you very much.
Thank you very much, Jose, for that. Let's now turn our attention to Jacqueline from UNEP. UNEP is at the forefront of global efforts to address air pollution and environmental determinants of health. And as air pollution is a major risk factor for NCDs, particularly, as we've just heard from Jose, chronic respiratory disease, your perspective on aligning environmental action with health objectives is especially important at this stage of implementation?
Thank you for the opportunity and for the question. I thought the 4 minutes was a joke, but it doesn't seem so. So I will start with the last part of my intervention, which is what we can do. And then I'll provide a little example. We can prevent, we can modify. We know that investment makes the economic case. Social solidarity, as Your Excellency was explaining, is achievable. We can achieve those. There are little things that we can do, and there are big things that we can do. So I will maybe put back to you a question, and it is, what does pollution, air quality, antimicrobial resistance, and plastics have in common, for example? I know the immediate thought that comes into you is NCDs, but actually it's much more than that. And if we look at how the systems work in the places that we live, in the universe, in our Earth, everything is interconnected. And you might have heard about the Trojan horse, you know, that one that was hidden something over there in the ankle and nobody saw it, but it was there. Well, this is what non-communicable diseases in reality are. And this is what connects all of those topics that I was referring to. If we look at air, for example, particle matter, I always confuse with the Spanish and say it the other way around, can transport over the seas genes of antimicrobial resistance. Plastics can bring genes of antimicrobial resistance to the middle of the ocean. So we are a system. And yes, your words are very powerful. We have to work together. There is no other possibility for us. Investments. Why investing? Because if we invest in prevention, and the World Bank, an authority on these topics, can tell you a lot of numbers. One that I will be bringing to you today. If you invest, for example, in preventing antimicrobial resistance, which is also one of the biggest topics of the NCDs, you can gain up to 20 times your investment. Looks very naive and very little, but imagine 1 million, 20 million. It's not $1, $20, but in some cases, if you want social solidarity, those $20 make a difference. It brings vaccines, it brings food, it brings the opportunity of well-being for many people. So what is the message here? We have the solutions. We have the tools that we need. We need to work together to make this a different world. But in reality, we have to acknowledge that we are the drivers of change, all of us, not only the international organizations, but everybody sitting here. And apologies, because I know I went a little over. Thank you.
Well, thank you very much. But I don't know whether it's my clock, but you've still got another 1 minute and 15 seconds. So if you want to add anything, but I tell you what, I did take away 3 points, but I'd like you to also reflect on one other one. You highlighted the economic case, really important. I loved your phrase, little things and big things, because too often we only think about the big things, but I think that's really interesting. I thought the way you described system responses. But one thing I'd like to ask you a bit more, if there's one agenda that my kids are interested in, of all the things we're talking about, it's about the environment. And so in a minute, tell us about how we can get the, how we can harness that energy from the young and what UNEP's doing in that area.
I was not expecting this question. And I don't want to sound maybe belly button here, but if our environment is not healthy, we will never be healthy. So protecting and preserving the ecosystem services, the natural environment, that involves water, soil, air, but also the places we live, the ecosystems we are in. And that starts with simple acts, not throwing a little paper on or in the street. Here you don't see those things because society has a different history, but in many, many places you see that everywhere. Tobacco, I shouldn't even say the cigarettes things, everything. That's are very, very, very simple things that we can start putting forward. Plastics, think before getting any plastic things. Of course, you cannot see me because I have my computer that has plastics, but there are essential uses. Let them also think about essential uses. What is a must have? what are those things that are in a way bringing satisfaction but are not necessary and they can live without it. That will help the environment, the resources, the future for them.
Thank you very much indeed. Yeah. I'll move on to May. IEA plays a critical role in strengthening national capacities, capabilities for cancer control, diagnostics, radiation medicine. Its technical model offers valuable lessons on translating global commitments into national action. Be really interested in your reflections on that, and also what it perhaps means to the work of the task force.
Thank you very much. It's a pleasure to be here and appreciate all the good work that the UN Interagency Task Force and Secretariat have been doing over the years. I hope you can hear me. I'm not very good at giving a loud voice projecting. But when we're thinking today of our transition and commitments from the 2025 political declaration and the vital work of implementation, we have to think of many opportunities to be able to implement in what areas are going well and others that are more difficult. And with that, I'd like to also say that we have an additional thing, which is the WHA Resolution 79 to highlight radiation medicine and imaging and so forth as another pillar. So between all of these, we want to say that we cannot treat or address what we can't see. And hence the importance of looking at some of the areas that the IAEA is supporting at the national level and across the board, including standards, which is basically imaging, radiotherapy, and nuclear medicine. So not only can we not diagnose, but we can't monitor, we can't look at our results, and everything that we do across the board suffers. So if we think of many situations on the ground, we've seen it in many countries where one part of the cancer control continuum is supported and the others are left behind, then we end up hitting a wall. So examples of screening in cervix cancer where you find cases and then you tell them, sorry, we don't have radiotherapy to treat you, for example. So all of these things are problematic and they extend from the curative to the palliative areas. So we have to integrate these into functional health systems. Without that, it's not sufficient. We understand in many cases we hear that maybe it's not cost effective. We've heard that before. Maybe it's too complicated. But the reality is we've shown through multiple Lancet Oncology commissions that the IAEA co-led that this is not the case and that it is cost effective. And it's not cost effective because of just the treatment, but what happens downstream that makes it cost effective. Unnecessary treatments, unnecessary surgeries, and so forth. So diagnostic and treatment capacities are important. But remember, diagnostics, I'm mentioning cancer because I'll mention the Raise of Hope initiative, which is a big IAEA initiative, but that's not all that's affected. Lung, neurological diseases, cardiac diseases, all of these are affected by the same imaging issues that we're talking about. So the role is explicitly recognized in the WHA 78.13 resolution, which provides us the framework to translate these high-level commitments that all member states made into actionable, practical delivery. But in spite of our recognition and member states recognizing this, equity is still a problem. We have a lot of data from our databases, examples that if you scale up imaging, you could avert 2.46 million deaths and generate economic returns. The approximation was put in $1, you get $12 back, which is not bad for something that's considered not cost effective and difficult to implement. We can look at these through the Imagine database. If you're interested, DIRAC, we have multiple of these. And this year and approximately 2 years ago, we started looking at it as an implementation of technology measure within WIPO. So I think it's really a very interesting way of looking at these technologies. So if you have a CT scanner, one CT scanner would serve 25,000 people in high-income countries. Low income is 1.6 million. Sounds bad, but then go to PET CT and the gap is even wider. So you have 250,000 people for one versus 250 million people in low-income countries. I mean, incredible. So how are we going to close the gap? Well, invest in technology, yes. Make sure it's done safely, make sure good quality, and go away from fragmented donations. We're seeing more and more of that as we move forward in the different areas. But the reality is fragmented donations, unless it's within a specific larger area, is not sufficient. So I think I'm gonna rush a little bit, but workforce is important, quality and safety and supply chains. The last thing I want to do, and I'll skip other than the rays of hope, which I'd be happy to share with you when we're done with this panel, is basically the UN Interagency Task Force. We're here as the friends of the task force, and we want to see, okay, so what does this do? For those who are not as engaged, the group has been coordinating and communicating between 40 UN agencies. And in my experience, it has been essential for us to be able to talk to each other in areas that might not be what we're working in. And we find new bridges for collaboration. In addition to that, it was reviewed and it was shared that was the case and it was very successful. So what are we going to do as we move forward? Well, we looked at several different options. And the third option was the one that seemed the most reasonable, looking at the benefit that we've seen from the UN Interagency Task Force. We've seen benefits in the UN joint programs. We've seen benefits in joint missions. We've seen benefits just knowing what the others do and communicating and coordinating. But because of a lot of difficulties, financial and otherwise, so can we keep the same situation? Well, we were suggesting to have possibly working groups, each agency with a focal point for the main mandates that they're working on, always communicated, coordinated by the task force secretariat at WHO. So we would still maintain that oversight, but we would support the process a bit more through the different agencies that are parts of this. And in doing so, we hope that we will be able to continue the work of the task force into the future and continue to coordinate. I think this is not the time to stop coordination. This is the time to implement coordination. So with that, I don't want to take too much time. UN working as one, but also as partners, because the task force has and many activities included many of the partners around the team. Thank you very much.
Okay. Thanks, May. That was really helpful and very descriptive of the cancer continuum, thinking about that right along the way. The importance of health systems, again, cost effectiveness and economics, what the issue of equity, really important, workforce. And then thanks for putting some color and some of your thinking around a slide around options. I think that's helpful for people to hear. Let's move straight on to Michaela Friedberg's stories of video intervention. You got that?
Ready?
Ready now.
Dear friends and colleagues, thank you for the opportunity to contribute and my sincere appreciation to the UN Interagency Task Force on Non-Communicable Diseases for its continued leadership, including its mission to Thailand. And I also want to thank you for the development on the investment case that you have made on the NCDs. This support has helped to translate global commitments into concrete actions. That engagement has been instrumental in advancing a more coordinated whole of government and whole of society response. The findings are clear. Non-communicable diseases are the leading cause of death in Thailand, accounting for approximately 74% of all death and placing a significant burden both on the health system and the economy. The investment case has strengthened the economic rationale for action and reinforced the need to move from policy ambition to financed implementation. Thailand has made important progress, including strong policy measures on tobacco, alcohol, and universal health coverage. However, the challenge remains complex and evolving. Key risk factors such as hypertension, diabetes, and increasingly air pollution continue to drive the burden of disease. Sustained implementation will require deeper multi-sectorial coordination. It will require predictable financing and stronger accountability mechanisms. Here, I want to focus on air pollution in particular, as it is an area where we see both urgency and opportunity. It is one of the most significant environmental risk factors for the NCDs, contributing to tens of thousands of deaths annually in Thailand and requiring action far beyond the health sector alone. We therefore welcome the task force initiative to focus the next edition of the awards on recognizing champions in the prevention and management of air pollution and chronic respiratory diseases. This focus reflects the importance of linking environmental, health, and development agendas into one coherent focus. Addressing these challenges require integrated cross-sectorial solutions, as I mentioned. This will include advancing sustainable transport to reduce emissions, improving agricultural practices, and ensure urban planning that supports healthier environments for citizens. Preventive, source-level action must be prioritized alongside strengthened capacity to address the health impacts of air pollution. This integrated approach mirrors the spirit of the 2025 political declaration and underscores the need for policy coherence across sectors. The United Nations in Thailand is working closely with national partners to support this integrated approach. This reflects the added value of coordinated UN action on complex development challenges such as the NCDs and aligns closely with the task force multi-sectoral model of engagement. In the context of the UN80 reform, this kind of coordinated country-focused support demonstrates how a more agile and better aligned UN system can deliver greater impact at the national level. Looking ahead, we are actively exploring the possibility of welcoming a further task force mission to Thailand, with a particular focus on air pollution and its link to non-communicable diseases. Such engagement would provide an important opportunity to strengthen policy coherence and accelerate implementation. It would also serve as a practical example of how the UN system is modernizing its support to countries through more integrated delivery platforms rather than fragmented inputs. The transition from commitment to implementation, as highlighted in today's discussion, will deepen on sustained political leadership focus, stronger financing, and effective coordination. It will also depend and deepen the focus on the UN system that is fit for purpose, streamlined, and focused on result, all as envisioned under the UN80 initiative. Thailand stands ready to continue advancing this agenda in partnership with the UN system and, of course, with the task force. Again, thank you so much for the support and the work you are leading.
Wow, you must have asked to do 4 minutes because I timed it to the second and it's 4 minutes. That's pretty cool. I think that was an excellent, really excellent presentation. Giving examples on air pollution and building on what we heard earlier from Jacqueline, giving some good examples of the need for multi-sectoral action, and then talking about the UN system and how it's got to deliver as one. So I think that's also very interesting. That builds also on the comments that May was making. So that's great. Now let's move over straight away to Natalia from UNDP. Natalia, tell us a bit about how countries can mobilize and align domestic resources, what financing approaches are showing the greatest promise at the moment in advancing implementation of the political declaration.
Sure, and I don't know why you hesitated there with UNDP, Nick. Anyways, on that note, I want to actually, before I go into the financing, I do want to say that I was really happy with your statement and also Michaela, that the role of this interagency task force. I'm really delighted that UNEP and the environmental determinants are so loud and clear in our meeting today. So I'll talk about financing and maybe throw in some environmental determinants. So I'm a social epidemiologist in training, that's a lot on the environment. But I think your remarks from South Africa really capture the reality of the ground, right? NCDs have always been underfunded. We know that. And now we're facing a real disruption in global aid. We're also seeing a war, debt, of many wars, conflict, declining aid, growing pressures for finance. So it is a really impossible situation for many governments. So I think taking sustainable financing seriously is at the core of what we need to be doing. But I don't think we can afford to do it, issue by issue or one NCD with one NCD. And we have to think about it holistically, including with other agendas, health agendas, because if you are a minister of health, you can't, at this moment, all your health financing has collapsed, but also so has many other sort of financing. So I do think it's sort of an issue of solidarity and thinking smartly across agendas. So if we are to try to focus on alignment and coherence, what are some of the ways forward? Again, it will depend from country to country. And I think the health sovereignty agenda is a really central one. So really the UN standing behind and aligning behind is our kind of principle that we need to move forward. But the first point, and for those of you who were at the NCD Alliance event before, I reiterated that we need to think about growing the pie of domestic resources. And health taxes are one that comes up not only because it gives you resources, but it's also such an important health tool. Health taxes, and whether we're talking about the WHO-led 3x35 initiative, it's really a practical way for governments to incentivize prevention by taxing tobacco, sugary sweetened beverages, as well as alcohol, and then connect that revenue generation to visible public priorities. And there are some good examples. I'll mention Angola, where in 2025, the budget law doubled the excise tobacco tax and on tobacco and on spirits, and channels 60% of that revenue to health and local sanitation. And this has been supported by UNDP as well as through our Tax for SDGs initiative and partnership with WHO. So there are good examples. Now, we also heard at your event, Barbados talking about debt swaps that they're negotiating and discussing with banks. So there is innovation that's happening in the financing space, and we all need to be part of that conversation. But we also need to think about how do we make the cost of inaction visible? And Alexi, you mentioned the investment cases. It's really great, UNDP, WHO, the task force have been doing a range of investment cases, and they really show you what to prioritize. And we see that governments have been implementing reforms because of that. Some of those reforms cost very little because they're legal reforms or they're regulatory reforms. And so that is really important. The third one is that we need to think about how do we get into the broader sustainable financing discussions, not have our own within the health sector. And this is where UNDP's integrated national financing frameworks come into play. Because often, we're talking about policy coherence, and here's where I'll talk about air pollution. I mentioned it earlier too. On one hand, the health community has been very active to say health harming products should be taxed, but fossil fuels are a health harming product. And I hope all of us can start using that language that we actually subsidize. And that policy and coherence is one that we need to take on, and we have a lot to do. And work UNDP has been doing with the Clean Air Fund is to show, why is this incoherence? We all can breathe the air and know that it's costing us our tourism, it's costing us our productivity, it's costing us our lives, our children, and yet we're not doing enough. So we need to make some of the financial decisions more visible. And then finally, it's to treat governance as part of financing. The NCD community has been a leader on industry interference, on thinking about, multi-sectoral action. I think we need to continue to lead there. And I'm also proud, Nick, with a lot of the work that we've been doing jointly with you, but also with the G20 and G7 Health and Development Partnership around bringing in parliamentarian and the Global Legislators Initiative. I think we need to tap into new networks, and legislation and legislators are really, really great because they can help us align our regulation and our accountability frameworks and bring civil society into the conversation so that health isn't seen as a cost, but really as an investment, so that people won't protest when, say, the price of gas goes up, but they will celebrate it and say, okay, now at least I won't need to pay for my child's hospitalization out of pocket. So really making the financial case visible. So UNDP is so happy to be part of this interagency task force and really happy to have, the range of voices of the UN working together, because we do need these integrated solutions to move forward on the SDGs and health and well-being. Thanks.
So thanks a lot, Natalie, for just reminding us about the holistic nature of health and development. You can't see NCDs in a silo from either health or from other development issues. We're talking about the financing space and making sure that the costs are visible. We talked about the costs are visible and the importance, therefore, of getting this onto legislators in the agenda and reminding us yet again that so much when it comes to regulation and legislation, fiscal issues are around governance. So really important. And then remind us again about integrated financing frameworks. So thanks a lot for that. Now, Alison, over to you.
Thanks so much, Nick. And it's always a challenge when you're so late in the panel, so many of the great points you wanted to make we made, particularly on the financing. However, it does give me an opportunity to make perhaps the first application for the awards on air pollution. NCD Alliance, with funding support from Halion, is releasing a report tomorrow called A Breathable Planet, Best Practices for Clean Air Policies to Meet NCD Targets. And we're hoping that this will be a really useful report. It comes at a critical moment, as you said. The political declaration in the countries committed to step up action on air pollution as part of their broader efforts. And in the same year, last year, countries also agreed to a target of halving premature death caused by human-led air pollution by 2040 as part of the WHO's updated roadmap on enhanced global response to adverse health effects on air pollution. So this report is highlighting best practices and country examples of policies that are in place. And in fact, are already working. Policies like restricting vehicle emissions, phasing out fossil fuels, expanding access to clean energy and promoting active mobility. And all these actions, as others have said, bring significant economic benefits. They improve social equity and they support progress towards other goals for climate action, physical activity and more sustainable, healthier food systems. And honestly, that bringing home that health message about the costs of climate action are so important to bring home to people why they get a benefit out of these actions now and not sometime in the future. But I'm also going to focus on a second point that I'd like to make, which is in the political declaration, interestingly enough, there is paragraph 78 that specifically refers to United Nations agencies, regional and intergovernmental organizations supporting member states to deliver action on NCDs, including specifically the UN Interagency Task Force and the Health for Life Fund. So it's wonderful that this is specifically mentioned in the political declaration. There are really interesting things about the NCD and mental health agenda, not least that it's not just a health agenda, it is multi-sectoral. And the United Nations Interagency Task Force is a really good example of that in action. The other thing where I'd like to bring connection to is this dialogue and beginnings of process around global health architecture and trying to make the shift to that. And one of the main things we've just, again, another thing that we've released this week is a paper on NCDs in the global health architecture and its reform. And one of the main things that we are concerned about and you'll hear us talking about is within the existing health architecture, which let's face it, was set up primarily for the Millennium Development Goals and infectious diseases and maternal and child health, and has done amazing things in progressing that, has delivered on quite vertical programming and financing. And we need to get beyond that. But within that conversation right now, around the table, there is no centre of gravity around NCDs and mental health. There's no global health initiative at that table representing NCDs. And just to give an example of that, NCDs are responsible for around 75% of global mortality. It's the leading cause of disease, disability and death. It's about 6% of the WHO's budget. So it's a real example of where we need to make sure there's a shift. And we may not, whether or not there's huge structural change, it doesn't really matter as long as we recognise that everybody has to play a part in making this shift towards a multi-sectoral approach and a more integrated approach to delivering prevention and care. And I think the Interagency Task Force is a really great example. And I really hope it builds some of that and plays that role of building some centre of gravity on that within the dialogue.
Alison, thanks very much indeed. Thanks so much for reminding us about this the lack of center of gravity and some of the issues with NCDs and, you know, the sustainable development goals follow on from the Millennium Development. Really, they haven't made that step change, as you're sort of alluding to, and the importance of the multi-sector agenda and just how difficult that is to implement that, how crucial it is. Thanks for reminding us all about your global health architecture paper. It's a really good paper. And if people haven't had a chance to look at it, I'm sure if you type into Google and see the last global health architecture paper, it will come up. And it's really good. And I always think that the NCD Alliance papers are always really well thought through and well articulated. So thanks for that. And then thanks for being a friend and for reminding us of the political declaration you listened about the UN system. Quite fun. So thanks very much. Now, before I pass back to Guy to introduce our second co-chair, I'm going to invite Lamia to talk about the challenge that you have in your region, the Eastern Mediterranean region, where you've got so many emergencies and protracted crises. One tackles in response to non-communicable diseases and mental health. I'm sure you're going to tell us how these crises are making the situation even worse, or you can think about tackling.
Absolutely. So thank you. Thank you once again. I'm very happy to be part of this discussion. Indeed, I come from the Eastern Mediterranean region, a region which hosts around 750 million people, but it also hosts one of the world's worst humanitarian crises in many of our member states, from Syria to my own country, Sudan, from Somalia to Afghanistan. We have so many emergencies happening in the region right now. And even countries which, like Iran, which used to boast one of the excellent health systems, are now struggling with the emergency context in the region. And in the region, we have, the region has around almost 50%, to be explicit, 46% of the world's displaced population. And it hosts 1/3 of the world's population who are in need of humanitarian support. So indeed, a lot of challenges, a region which requires a lot of support. But, and maybe this is a reason why we cannot afford not to prioritize NCDs. We need to prioritize them because even with all these competing priorities, NCDs are a huge burden. They account, like many parts of the world, for almost 3/4 of that burden. And the data that we have shows that approximately 2.8 million people died due to NCDs. So there are many ways we can actually make that happen and have NCDs as a priority. Firstly, we're working to ensure that it gets embedded. NCDs are embedded within the humanitarian response. They're part of the preparedness and response plans, and working with the different departments. So in WHO, we're walking the talk. We're talking to different departments like the emergency department, so that if this is where the money is and it's not sitting with us in NCDs, then this is how we can actually make sure that NCD services are part of their planning and their response. And then, of course, it's critical that it's also embedded within the existing platform. So primary healthcare, we're working with health systems and also ensuring that that is in place. Again, there was a lot of talk about innovation. So what we're doing now is also trying to see how we could bring it as a priority to our member states. So the political declaration does not put a lot of weight on NCDs and emergencies. I must say that it's that there's no target, for example, but we have in the region where we're able to endorse a regional framework for NCDs and emergencies. It was unanimously approved by our member states in 2023. And this gives our member states a framework through which they can frame their emergency response. It includes all the relevant domains. It talks about the different phases of the response. And it gives them the different levers that they need to take forward the response. And we're now working on an operational guide, which will actually help us to give member states a guide on that framework. I think another aspect that we're doing, which is an innovation, is the NCD emergency kit. And since 2017, many countries in our region have received that kit to support their response. It's a kit that includes, that is set to serve 10,000 people for a period of 3 months. And as we speak now, we're deploying that kit to countries like Lebanon, from the Dubai hub, the WHO Dubai hub, which is where we pre-position the kits so that whenever there's an emergency in a country, it can actually be provided. And then, of course, we're also working on issues around having the right expert networks within the region. So renal disease emerged as a priority within many of the countries in emergencies. So that is also one area of having expert networks so that we bring this technical support closer to member states. And I think also the WHO collaborating centers also provide that opportunity. We have one that is on asthma, that is in Oman, and that is now supported by other countries, on diabetes in Pakistan, and so on. One thing I want to emphasize is partnerships, which have been critical to the work we do. Of course, we have so many partnerships, and I really want to appreciate all the different actors that have been supporting this response in the region. Many of the friends here are also part of that response, and I really want to appreciate the support and to encourage continuity of that support. Emergencies are apparently not going away anytime soon, and there's a lot that we need to do to rebuild the infrastructure in so many of these countries. And that brings me to my last point, which is about the sustainability of the services and ensuring that the response also works towards strengthening the health system. Our regional director has launched flagship initiatives in the region through her regional strategy, and we're using that to support aspects like access to medicines and health workforce, because so many of our countries actually need it. So these are the aspects from our region, and please remember the Eastern Mediterranean region in your efforts, your opportunities, and everything. Thank you.
Thanks so much for describing the magnitude of the situation, the operations that are going on, the NCD Emergency Kit flagship project, and again, for highlighting the partnerships. And this is all about partnerships and working together. So thanks very much indeed. So Guy, back to you.
Thanks, Nick, and great discussions. And on the heels of that, important interventions from so many task force members and friends. It's really a pleasure to welcome Deputy Minister of Russian Federation on the highlight. Thanks for making the time to join us, but also very much appreciate co-hosting the meeting with South Africa. We heard very important message from Sholofelo from her experience from South Africa. You just heard great interventions, some of the great interventions of the panel on the need to continue the great work of the task force on joint collaborative cross-sectoral interventions and implementation models for that political declaration. We've been a long-standing champion since the inception of the task force itself and through the years of its progress. Looking forward to some comments on that support.
Thank you very much, Guy, and good afternoon, honorable colleagues. Let me welcome you with gratitude on behalf of the Russian Federation. Well, actually, I was going to make a long introductory remarks, but I've late. I think most of my key points have already been mentioned. I didn't want to sound like I've heard someone else's words, but I still believe I should say at least several words. As Clive Hughes once said, friendship is born at the moment when one person says to another, "What, you too? I thought I was the only one." And actually, I believe that this perfectly captures the essence of our work on NCD. I vividly remember the NCD conference in Moscow and the extensive follow-up work by WHO and task force. And this very moment, we began to realize how common our challenges are and how shared our obstacles truly are. And in a short period of time, significant progress has been made. Best practices have been established, analytical tools developed, and coordination mechanisms in place. And I should frankly say that task force has played a major role in this progress. In our country, combating NCD is a key priority of healthcare policy. We continue to promote healthy lifestyle. We're trying to create additional incentives for that. For instance, certain products, including fruits and vegetables, we reduced VAT rate of 10%. Since 2023, Russia imposed an excise tax on sugar sweetened beverage. The rate increased starting in 2025. And I should underline that the revenues generated are allocated to fund federal project aimed at combating diabetes. We put attention to preventing childhood obesity, and it remains of critical focus. We see that NCD policy really brings very good results, and we see that the alcohol consumption, for instance, halved during the active anti-alcohol campaign in the Russian Federation. Smoking prevalence almost halved since 2008, and we should. We still believe that the task force should stay crucial in converting the political ideas, political commitments to the concrete actions in countries. And we should use this mechanism to share best practices, to implement best practices in countries, and to support countries and the governments with the up-to-date information on these practices. And in conclusion, I would like to express my gratitude again to the WHO and to everyone working in the task force as well, all those taking part in this. So thank you.
Thank you, Oleg. That's an excellent way to close this excellent meeting. We've heard so many calls to action. Your closing brings that together. So the need to continue the great efforts of these 12 years of the task force, focus on sharing best practices, focus on implementation models, focus on collaborative approaches to address the many intersecting agendas that impact the ability of countries to deliver on NCDs and mental health. Thank you all. Thank you all for joining. It's been a great discussion. I'm sure we'll get a very, very detailed summary of this meeting, I would say. We'll get some of the key points, key discussion points that were shared in some of the panels. Great intervention by the panels. Looking forward to those summaries.